Mm. Uh, Hello, everybody. It's so nice to see you again. You remember we had the community-based education session before in year one, and now we are having the problem-based learning session. Before I start, there is some noise from the microphone of one of you. Would you please all mute your microphones until I ask you to speak? Yes, that's better. Okay. Um, I just hope my own microphone is not muted. Okay. Management, because we have a lot of um, work to do in just 2 hours. I'll start discussing some things about problem-based learning with your contribution also for half an hour, and then you will be on your own in the breakout rooms as 4 groups. But now I would like very much to say that problem-based learning is one of the best innovative educational strategies that have been tested by so many health professionals, education institutions around the world. After being invented or created in the 60s of last century, lots of similar education strategies have been created to compete with the PBL, but none of them so far stood firm against PBL as a well-known now educational strategies that proved success in so many occasions. I knew that some of you already have experience in problem-based learning and already working in PBL schools. We selected or we took volunteers, 4 of you, to play the role of facilitators or class tutors during the exercise that we will have in the breakout rooms. The rest will play the role of students when tackling a problem to solve this problem by problem solving. But before going to this exercise, I would like to discuss with you the advantages and the strength points of problem-based learning that would tell us why this move started very strongly in the 60s of last centuries, and it stayed very firm till now. Even the number of PBL schools have increased very much in the world, and especially in our region, which is the Eastern Mediterranean region and North Africa. Would any of you help us know one of those strengths or merits that that would tell us why after centuries of teaching medicine the classical way, we suddenly we decided to change to problem-based learning. What exactly problem-based learning mean to you in terms of the education strategies that most of you know? Please raise your hand when you want to speak. I would like your answer to be very simple. It doesn't have to be an educational strategy or so, but tell me what's your idea about PBL? What would PBL do to enhance medical education? Amira Abdelkarim.
For my previous experience in problem-based learning, students after problem-based learning methods are more self-directed learning. So based on this, they acquire knowledge better, they can memorize it better and recall it better than the ordinary way, because they know they generated it by themselves. They didn't receive it as one-way receiver. So this
Mhm.
is had better outcomes
Thank you,
as a medical
Amira.
education wise.
Thank you, Amira. You work for which school, Amira, or
Uh,
which university?
I'm working in Tanta Faculty of Medicine. We have two
Tanta Faculty
programs.
of Medicine. Okay,
Uh, the new one, we implement problem-based learning in
problem-based
credit
learning.
hours, not in the
Uh,
ordinary one.
Okay, okay. Thank you very much. Amira
Thank
said a very important point about or advantage about PBL. PBL actually will allow us to do the paradigm shift from teaching to learning. You know, it's a paradigm shift. It's something huge in the educational strategies to shift your education from being based on teaching and teachers to being based on learning and learners. That's why they call it learner-centered education, where students are active learners rather than passive learners if you apply teaching. Excellent, Amira. So this is one advantage that I want you to know. Shayma Abdel Sattar.
Assalamu alaikum.
Alaykum
Problem-based
salam.
learning makes students feel that they are in real situations when they come to hospital and they meet patients. So they will not get feel strange but they get accustomed to these situations before when they are comfortably with their peers and their teachers. So also the problem-based learning makes the students eager to learn and search for solutions for these clinical scenarios.
Excellent, Amira. Excellent, Shayma. I'm sorry. Okay, could you summarize what you've said, Shayma, in one or two words or one or two concepts in education?
I think a real life experience.
Okay, real life experience will lead the students and the whole curriculum and the faculty to set the environment for relevance in medical education, that the students work on real problems, real health problems of the community and the community health needs, the essential national health needs of the community. So, so problem-based learning is also about relevance, right? Because we choose the problems as authentic problems. Authenticity.
Yes.
This is the word that I was looking for. Authenticity of education. So that's why we don't just grab any problem and put it to the students. No, we have to select the problems first to be relevant to the community health needs and priority health approach. Excellent, excellent.
Yes.
So the paradigm shift from teaching to learning and the authenticity and relevance of medical education to the community health needs and priority health problems. Salwa Hassanin.
Assalamu alaikum, doctor. I'm a community health
Alaykum
nurse,
salam.
and I apply problem-based learning in community health nursing practice in the community. As you said, Prof, I select the problem based on the community need. As well, I apply it in health education and the merge course, and the student really self-directed, motivated, self-goal-oriented, and the grade and the academic achievement, it really يعني, shifted, as you said, the Prof, from traditional to paradigm of student-centered learning.
Excellent. Thank you very much, Salwa. Amal Mahfouz. Those who already have spoken, please down your hand. Amal.
Yes, doctor. Assalamu alaikum.
Alaykum assalam wa rahmatullah.
Yes,
Where are you working, Amal?
I am working in Egyptian Drug Authority.
Okay, good.
But I have worked in private university at MTI.
Okay.
So
Okay.
I think that problem-based learning, it's like a case of simulation education, as we sometimes we create a scenario which match a specific problem that we need to learn students how to manage or deal with.
Okay. Thank you. Thank you, Amal. Still, Salwa and Amira have raised hands. Do you want to speak again, or you forgot to lower your hand?
No, I forgot, Prof. I forgot. Thank you.
Okay, Amira, you're still raising your hand.
This is another Amira. It's not me. It's Dr. Amira.
Another Amira. I was
Yeah.
suspecting that. Yes. Okay, go ahead, Amira. Where are you working, Amira?
Okay, I'm working in Must University.
In Must. Okay.
Okay. What I was
Yeah.
thinking about that one of the benefits I am already practically applying that this is very beneficial method in the clinical reasoning. It helps the
Clinical
students
reasoning.
to
Yeah,
get the
yeah,
depth
yeah.
in understanding of the case.
Yeah,
So
it's
the
one of the very important skills
Yes.
for a clinician. Would you
Yeah.
explain to your colleagues the meaning of clinical reasoning in simple words?
In simple words, we go through what is the symptomatology of the patients and the differential diagnosis of this symptomatology in different systems. This means it starts with the symptom of the patients rather than to be the topic of the disease. So when the patient is complaining of dyspnea, we recall what is the reason for the dyspnea in cardiovascular, for example, for respiratory system, for abdominal causes, for general causes, for miscellaneous causes. So it gives the students the way that when the patient is presented with certain symptom, he can differentiate and put the differential diagnosis so he can reach the definitive diagnosis.
Excellent, Amira. So it's a mental exercise
Yes.
that
Mental
allows the
process.
clinician to analyze one step to begin with. To go
Yeah.
to the next step, he has to or she has to make an analysis to the situation so he can
And also
take
critical
the
thinking.
next step. Of course, and
Yes.
but critical thinking is a little
Is another
different from
concept.
is another
Yes.
skill. Yeah.
Yeah.
Okay. Thank you, Amira.
Thank you, Prof.
Anybody else? Shayma Abdel Sattar still? No. Now you all spoke. If I ask you, what about the curriculum itself? What difference PBL would make to the curriculum? Is the PBL curriculum very similar to the traditional curriculum, for instance? Think for 1 second and give me the answer. Is it the same curriculum like the traditional curricula, or there is something very peculiar that at least remember from the community-based education session, we had something in common with community-based education and problem-based learning. Manjusha, do I pronounce your name right?
Yes, yes.
Okay. Okay, you have the
Uh,
answer for that.
yes, I think the traditional learning is teacher oriented. It is kind of didactic lectures, and the PBL is learner oriented, and it is more focused on the needs of the learner based on
This
the
is in
learner's
relation to the teaching learning. But what about the curriculum design? What's so,
curriculum.
yeah, what's so peculiar for
Okay.
both problem-based learning and community-based education? And please remember from last year when we talked about this, there is something in common between both problem-based learning and community-based education. What was
The
that?
problem-based learning will have critical thinking, so we have to design the curriculum at the top of the HOTS, which is there in the teaching learning method. So we
Yeah,
have to
but
design it
yeah,
from
but this is related to the student skills and teaching and learning again. But the curriculum itself, the curriculum design, when you design a curriculum for PBL, what main
it is
things that
retrospective.
it is what?
Retrospective.
Retrospective.
Yes. First we will
No,
take the
not
case,
exactly.
then we will
Not
start for the
well. The case means that you're talking about the instructional method, that we
yes.
take a case, but I'm talking about the curriculum design itself. You forgot integration. We talked about
Yes,
integration,
integration is one.
that
Yes.
problem-based learning and community-based education are two best examples for
Integration.
integration. They are the
Yes.
highest level number what
Yes.
and what,
One.
according to Hardin's integration scale, if you remember.
Integration. Yes.
What is the number of the level of PBL? Do you remember? Anybody remember? No? Shaima, do you remember? No?
لا,
Okay.
unfortunately not. I would say
Okay.
the problem-based learning shows interprofessional collaborations between multiple specialties.
Yes,
That's integration.
not interprofessional. It's interdisciplinary.
And
Interdisciplinary.
yes.
Yeah, interprofessional, it means between medicine and nursing and, No, interdisciplinary means that it integrates the basic and the clinical sciences together to make the problem as an integrated form. This is
Yes.
called the interdisciplinary, and this is level number 10, the one just before the highest level, which is number 11. As you know from last year when we discussed community-based education, was the best level, which is called transdisciplinary, because the students themselves in the community, they do the integration themselves. That's why this is the best level of integration in medical curriculum. By this, we come close to starting your practical work today. You will play the role of students. If you look, you will find assignment 1 open now. on Moodle. You will find assignment 1 open. It was closed before. Now it's open. Get it. And they will help us go to the breakout rooms. We have 4 breakout rooms. We will work as 4 groups or 4 classes. We have also 4 facilitators, fellow facilitators. Actually, we selected them from this batch. They will help you go through solving the problem by Maastricht problem solving process, which is called 7 jumps of problem solving. Before you start, you have to select one of you or nominate one of you as the chair of the group, and scrub or rapporteur. Okay, and then we have the facilitator. One of you is assigned already to be the facilitator. Please manage your time. That's why it's better that you also have a timekeeper with you, because we have so many tasks to do in just 90 minutes. By the end of the 90 minutes, we expect that you will fill up the what's called student PBL student template with all the information that's written in that template. You will also find it within your resources, and then you will submit it, in on the discussion forum. Okay. Any questions? Either we still have 5 minutes. Any questions about PBL before we go to the breakout rooms? Unmute yourself. I can see you, I guess, from Bahrain or Saudi Arabia, one of the Gulf regions. But I see your name, Ahmed Ibrahim. Ahmed Ibrahim. Would you unmute yourself, please? Ahmed? No, we can't hear you. You're muted. Okay, it seems yeah, now you're unmuted. Would you try to speak now, please? Ahmed?
Yeah, do you hear me now?
Yeah, I can hear you.
Yeah.
Okay. Yeah. Okay, Ahmed, do you have a question?
No, I'm fine. It's okay.
You are fine. Okay.
Yeah.
Good. Any of you is having a question either about PBL in general or the task that you are going to do in 90 minutes in the breakout rooms? Any questions? No? Okay. So according to the table that Ms. Hikmat distributed to all of us, please go to your group. Shayma is having a question. Shayma.
مع حضرتك يا دكتور.
Hikmat. Okay, Ms. Hikmat. They are ready now.
I see there's a concept mapping in the fellows deliverables. What's concept mapping?
Okay, you will find among the literature that I sent you one of the papers describing exactly what's concept mapping. It seems that you didn't notice that paper, but there is a paper. Listen, in one word, because you don't have the luxury of time now to read papers about concept mapping, but when the students use the 7 jumps to solve the problem, one of the steps is to analyze the problem, to do analysis of the problem. And instead of doing it just mentally, do it on paper. Or here, you can use the keyboard to try to design this sort of analysis from top to bottom. Every time it fans like this until you reach a stage where everything in the problem is very clear to help you solve the problem. We call this concept mapping. It starts with some concepts in your head, and then you do some mapping to these concepts until you break down the problem to and analyze it to its original elements. This is what's called the concept mapping. Okay. Those of you who would be able to use the concept mapping during this session, this will be excellent. If you can't, that's okay. At least go through the 7 jumps with help from your facilitator. Okay?
Okay.
Yeah. So now please go to your breakout room. And thank you very much.
Okay, Doc.
Okay.
دكتور وسام. اوكي.